One of the difficulties in trying to understand this thing we call chronic back and neck pain is first understanding that we don't really know what causes the pain. Oftentimes when we go to the doctor, someone goes to the doctor for back and neck pain, they're given a diagnosis. But in truth, if a patient went to 4 or 5 different doctors with exactly the same presenting symptoms, they'd get 4 or 5 or 6 different diagnoses. The only way to change that is measurement. If I were to ask you how tall you were, you'd tell me 5'8", 6 feet tall. And if I ask you how you know that, you would say you measured it. If I ask you how much you weighed, you would tell me 140 pounds or 90 kilograms, whatever the weight might be. And if I ask you again how you know that, you'd say, well, I weighed myself. It's a fairly simple question and a fairly simple answer. But there's a common measurement, a common metric that you and I both have. And in that common metric, we understand each other and can communicate back and forth. That's been missing in spine. That's been missing in musculoskeletal medicine in general, but specifically in spine. And yet we now have tools that will allow us to help contain that information and then be able to have a way to talk to one another. This is why so many different cost prohibitive tests are done on patients. We do MRIs, we do x-rays, we do CT scans, we do myelogram CT scans, we do surgeries, we do pain management, all without really measuring the patient to see where they are, where they're beginning, and where they end. So the introduction of evidence-based medicine, the introduction of objective measurement is critical in the management of chronic back and neck pain.